Thank you very much, David. And thank you, Michael and Dr. Sathya, for your leadership on this issue. It's a pleasure to be here with you today to moderate this session on gun violence prevention in communities of color. I have the pleasure of introducing an esteemed panel here today, and it's such a nice segue from what was just talked about by Senator Murphy. Given his call to us, this is about communities, and this is about communities of color. So let me begin by introducing our panelists. We have Erica Ford. She's the CEO of LifeCamp. She has dedicated her life to the liberation of her people from oppression and racism. And as CEO and founder of LifeCamp, she has played a pivotal role in transforming New York City as an architect for the city's risk management, crisis management system, the New York City Mobile Trauma Unit, and New York City's Peace Week. Dr. Andre Campbell. Dr. Campbell is a current professor of surgery at the University of California, San Francisco School of Medicine. He's an attending trauma surgeon at the Zuckerberg San Francisco General Hospital and Trauma Center. He's also the vice chair of diversity, equity, and inclusion in the Department of Surgery. Kelly Sampson is senior counsel and director of racial justice at Brady. With a background in litigation, human capital, and diversity and inclusion, Kelly works to prevent gun violence through cultivating a committed, informed, and effective pro bono attorney network, marshaling Brady's unique legal experience. She educates the courts on gun violence and related services, making the connection between gun violence prevention and racial justice. As you can see, these panelists bring a wealth of experience on today's topic and tremendous commitment. So I'd like to begin by asking each of them to perhaps share a project, to introduce themselves, share a project or initiative that they believe has a lot of hope for the future. We'll begin with Ms. Ford, and then Dr. Campbell and Ms. Sampson.
So thank you for having me today. It was beautiful words from Senator Chris Murphy. I love following all of that. I say ditto to all of what he said, and we must make what he said a reality. I think the expansion of the New York City crisis management system as a model to co-produce public safety around the nation and to do just as Senator Murphy says, is to transform lives, to help people heal from the generational trauma, as well as help to shift community norms so that we can help build generational wealth and help shift the narrative of how people show up every day, how people are allowed to live, the access to quality healthcare, and just the ability to live and get the oxygen that you need to breathe every day. And so in expanding the New York City crisis management system, not only through New York, but around the nation, would give life to those dreams and aspirations for me.
Thank you, Erica. Andre?
So it's really indeed an honor to be here, and I echo the comments that was said by the previous speaker. So I am a trauma surgeon. So what I do is I take care of people injured at the point of injury, and I try to do as best I can to save them. We've actually gotten really good at taking care of people injured, but we can't save everybody. And a long time ago, I recognized that in addition to doing what we do in the hospital, we had to do other things to outreach to our patients. So if I did not have to hear or comfort another mother who has lost a son, a daughter, a husband, a brother, or their father, then I would be happy, because hearing that plaintive wail of the mother crying is really absolutely terrible. So we've gotten good at taking care of people before they get to the hospital, in the hospital, afterwards. But the real challenges begins is when the real PTSD, post-traumatic stress, starts to lay in. So I'll just sort of highlight just a couple things. There's so many things to this. The things that why is it more common in people of color, it's structural determinants of social determinants of health, racism that plays a big part of that has been mentioned. This is a huge thing. in terms of dealing with, but we've kind of more come around to a public health approach to dealing with gun violence, and the public health approach as the best way to do it. So there are now programs out of hospitals that have been around for about 20 years now called violence interventional program or violence intervention programs. Where the one we have here is the wraparound program. And what happens is it takes the victim of violence afterwards and supports them with social programs, job opportunities, helping them deal with the legal system and all these things to sort of help develop their successful exit out of our system so they don't have to come back in. What we found is that these programs can work to get recidivism, but the chances of them coming back again from the double digits into the single digits. Also saves money to the healthcare system and people not engaged. So with that, I'll just sort of say a couple things and I'll let the other speakers go, but I'm really excited to be here today. Thank you so much.
Thanks, Andre. Kelly?
Hi, everyone. I just want to follow up with my fellow panelists and say that I'm so honored to be here. And I'm thankful for your time and the attention that you're paying to this particular aspect of the issue, which is racial justice and gun violence. And in terms of a project or a program that I'm most excited about, I actually want to pick up on something that Senator Murphy said. In his comments, he mentioned the fact that when you think about gun violence in the country, you have to think about our economic system, structural racism, and easy access to guns. And where Brady really falls and focuses is we are trying to work on that third component of it, which is the easy access to guns. And one of the programs that we've been working on is really holding the gun industry accountable for the role that it plays in allowing guns to get into communities and not having to face consequences for it and in fact profiting from it. So we have a variety of programs that are working on the easy access to guns, but one of them that I'm very excited about is our Combating Crime Guns program, which is really working around the sources of crime guns. And in particular, we have a proprietary algorithm which helps us understand exactly which gun dealers are the most problematic. And we can go around ATF, which has been hamstrung, and I can talk about that a little bit more, and work directly with local and state authorities to help them understand where they should be marshaling their resources to focus on the most problematic gun dealers in their communities and stop guns from getting into communities of color primarily. So I'm very excited about that work in particular.
Thank you. You know, our previous panelists and our last speaker, Senator Murphy, talked a lot about why are communities of color disproportionately affected by gun violence. Given your role in the communities and the work that you do, what are your thoughts? Why does gun violence affect our communities of color so much? I'll start with Erica.
Perfect. I think that as he also stated, the question of poverty, the question of access to resources, the lack of educational system that really educates our children, and then a disproportionate amount of resources that get put into our community or doesn't get put into our community that gets put into other communities. When you see a mass shooting in society, you see lots of resources, lots of support being put into that community. When shootings happen every day, 4 or 5 times a day, you don't see the same resources. You don't see the same value of the individual as even a human being. And so with those things happen, it is systematically planned out to give life that way, because there is no gun manufacturers in our community, and people are not born evil. They're not born killers, right? And so therefore it is a culture that is being cultivated by the system that we live in, from those various resources, from poverty, from lack of education, from lack of access to quality healthcare, quality food, and all of the things that we need to survive as a human being and be completed. And then the lack of ability to get the resources to help you to overcome the trauma that we have been faced for generation after generation after generation. And so I would say a accumulation of those things. And then the total denial of it being in existence, right? When we give more money to research and not to the ending of the problem, it's a problem, you know? And so it's a blatant.
Well said. Kelly, your thoughts?
I agree with everything that Erica said. And just to kind of continue down that line, I think the systemic issues can't be understated. And I think we've seen that most prominently in access. And we just went through an election where you had Black communities, people taking away polling locations, right? So you have people standing in line for 12 hours trying to access a ballot. But you can easily get a gun. And I think that that just goes to show where we put our resources. We live in a country where we have made it so much easier for people to get access to firearms than it is for them to get access to healthcare, access to democracy, access to a good education. And so I think that we could start with this problem as the question was posed, which is, why is gun violence so particularly harmful for communities of color, specifically Black and brown communities? But I think another way to look at it is why, whenever we have some sort of social ill, COVID-19 being a chief example, why is it that there's a disproportionate impact on these communities? And what these issues all have in common is that when you live in a country that has structural disadvantage built into it, baked into the system, it is going to mean that when there is a problem, people who are most vulnerable, who lack the least access, the least capacity to really change the system, are going to suffer the brunt of it. And so, the United States is a country where our gun violence is an outlier in the world, period. But within our country, because of the ways that we have taken away every opportunity for people to live full and meaningful lives, it's going to impact us more. And the last thing I'll just say on that fact is sometimes people will say, well, it's really Black on Black crime. It's really because of a culture of poverty, or they will try to characterize us as less than human, or somehow say that this is just innate, this is who we are. And we know that that is not true. And we know that these are really structural factors. And when you give people opportunities, when you pour resources into them, you see very different outcomes. So that's just the last thing I'll say about that, is this is not about somehow deficient humanity, but this is really about how we put people in situations that lead to these outcomes.
Mm-hmm.
Thank you. And lastly, Andre?
So this is a very complex problem that the previous speakers, Erica and Kelly, have really stated really quite eloquently. There are issues related to access, income, location, the structural violence issues. And I'll just sort of say something very interesting. A couple of years ago, we had a mass shooting here in San Francisco, and it was at the YouTube headquarters. And I came out and said a few things about what happened and how terrible it was. But I said something that really resonated really a lot. I said basically what I was saying essentially is, like, when the rich people get shot, I saw 50 cameras there. But the week before, when the poor people got shot, where there was a barbershop shooting where 6 people got shot, there was not as much media. So there's a little bit of a disproportionate effect of what happens when it comes to this. Every day, Black and brown people are being killed and being maimed and being hurt. And what is said, the previous speaker, Kelly, said about this disparity issue, it's a really big thing. So we know that there's disparate care and outcomes for cancer for people of color, right? We know it's the same in trauma. For many years, for 30 years, we've been studying this and saying that the outcome for head trauma, penetrating trauma, blunt trauma is different. And this may be related to pre-existing conditions, may be related to access to care, ability to where they go after this, but there's a disparate outcome. And of course, the COVID pandemic has really revealed once again what we know, that there's disparate outcomes. 1 in 900 African Americans have died from COVID. 1 in 1,200 of Latinx people have died from COVID. Native Americans are disproportionately affected. The pandemic has really brought to light how truly different the impacts are in minority communities. So this disparity issue is really huge. Now, what has happened more recently is that we're learning about these issues more. There's more money now going into research to help us understand exactly what it is, the issues related to access, where it happens. How could we understand this? So when I was in training during the crack epidemic many years ago, there were 2,800 murders in New York City, where I grew up and where I trained. That number now is in the 500 or 600. Why is those numbers like that? And why is the numbers in Philadelphia, Chicago, Baltimore, and other major cities, why is it different? We need to understand what is it different about these communities? Is it about job access, breakdown of family issues, access to care, the issues related to, well, I need to then go back and exact revenge. So there's all these issues that are layered on each other, the psychiatric, the social, the economic, and it's a very complex problem, and we need to understand it better. And by spending more time studying it, we will learn about why this disparate outcome is the way it is, on top of all the things that the previous speakers said.
Thank you, Andre. We're the last panel. The previous panel on policy, the private sector panel, the healthcare leaders panel, Senator Murphy, they all talked about actions and interventions, and they gave solutions going forward to move us from words to action. In your opinion, and I'll start with Erica, what of all of that that's been discussed today, of all of it, what actions, partnerships, interventions do you believe will make the biggest difference in communities of color around this issue? Erica?
I think that it's levels, it's layers. Government and the people on the ground doing the work have to come together, just as we did in building a crisis management system. So more funding. When we talk about the theory of defunding the police, it is exactly what everyone was talking about today. When you're moving resources like they move resources out of schools and healthcare all the time, then we're saying move some resources out of the line of criminalization and incarceration, out of the hammer, and put it into the therapeutic services, and put it into helping people heal, and put it into frontline workers who are intervening and mediating conflict. And so government and community must come together. Businesses and community must come together, because we must reinvest dollars into the communities and help build people up. Philanthropy and foundation must come together, and hospitals and community workers must come together. It's layered, just as all of the people who represented today.
Thank you.
Give other people a chance.
Andre?
I'll just sort of say, I know we're running short on time, so I'll say a couple of things. The American College of Surgeons Committee on Trauma has actually been going through some steps that the surgeons who care for these victims basically think we should go through. And this is looking at a public policy, public health review. One is starting out with showing that there's background checks, that everyone who gets a weapon should have background checks. People with psych history should not have it, should get access to it. People with criminal history shouldn't have it. Safe storage. These are just some of the things that we need to begin to look at in order to sort of say that we need to reduce the amount conflict that happens when you bring this issue up, because the reality is the United States is a very diverse area. I've had discussions with trauma surgeons who own large numbers of guns, and they are shooting as a part of their life. Whereas it's different for me and other folks, and we have to understand that different places, different approaches to dealing with guns, and we have to understand that it's not about taking away people's guns. It's about doing things safely, smartly, making changes that can make things better, because too many people of color are being killed because of gun violence. And we need to change the narrative so that we can make things better for the entire United States, because we can improve things, we can make things better. And I'm encouraged by all the changes going on nationally, the change in government, what was mentioned previously, that we will basically now be looking at things with our eyes open to make things better for everyone.
Thank you, Andre. Kelly?
I just think I like what Erica said about there being layers. And again, in the moment that we're in, I think COVID-19 is a perfect analogy, where there is not just one prevention that's going to make sense. You have to social distance, you have to wear a mask, you have to stay at home. And also we're working on therapeutics and a vaccine. I think gun violence is the same way. In addition to some of the very important work going on at the community level around intervention programs and helping put resources, one of the things that we've been working on is also stopping the source. And I think in terms of where we put our resources, we do put so many resources into criminalizing people and arresting them, while at the same time we have an industry that is basically flourishing and has built-in protections where people in the government have actually gone out of their way to pass legislation to help protect the gun industry, or to keep ATF, which is the federal agency responsible for regulating them, as hamstrung and as anemic as it can be, so it doesn't have the power to regulate. And so one of the things that we also think is really important is to bolster and put resources into the parts of the government that are supposedly supposed to be regulating this industry, so that you can't have gun dealers, some of whom will allow a felon to get a firearm and still be able to keep their license. That is a huge hole in the overall system of putting resources into a community, and also working around how we can stop people who feel like they have nowhere else to turn. So that's another thing I would just put out there, is also regulating the industry itself and holding them accountable, because they do play a huge role in allowing firearms to get into communities of color. And we've done a lot of research around the makeup of the industry, and it is overwhelmingly white, and in many ways overwhelmingly suburban. So I think that's really important as well.
Thank you. I know the hour is upon us, and so just ask the three of you to give us some final takeaways. If you could inspire this group that's listening today, and inspire beyond us into other communities and across the country, what would you say today to them? Andre, I'll start with you.
The first thing I'll just say is that I would like you all to take your collective energy and work towards putting me out of business, right? So if I don't have to take care of another person who is a shooting victim, a stabbing victim, or someone who has been injured lethally or sublethally by shootings. And the thing that has been fascinating to me is that in the midst of the COVID pandemic, we've had a huge surge of violent crime. There's been also an increase of domestic injuries by people who live with each other hurting us. So work towards helping to put me out of business, so I don't have to go to that mother who has had someone who they have lost and tell them that I've done everything I can to save their life, but I couldn't do it. I think that secondary, the public health issues will make a big difference. And I think working with policymakers, community intervention, issues of people like the Brady group, I mean, we're going to make a difference, and we're going to make it better. Thank you.
Thank you. Erica?
I think that we should let people know that there is an answer. There is an answer, that we have proved in history that our stuff is successful, and we can be successful again.
Thank you, Erica. And Kelly?
I'll just say that the healthcare community is so important, and you have a lot of power. And so I think one of the lessons we can learn in gun violence, and that we've been thinking about at Brady, is how to use the power that we have to make sure that when we think about this issue, we think about it holistically and elevate and amplify the work that people are doing, to think about it not just gun violence as it impacts suburban white children, but also gun violence as it impacts everyone. So as you do your work, as you get involved and hopefully continue to work on this issue, just think intersectionally and really hold the whole picture of gun violence in mind as you're thinking about this issue.
Well, those are some great thoughts. Well, thank you very much to our panelists today, and to all of our panelists and all of the participants and all of you that are registered today for this very important issue. We appreciate your time, and we appreciate the commitment that you have towards gun violence prevention in the country. Thank you.